Hey, Psych, Mr. Gallagher, back at you to wrap up Unit 8B, Clinical Psychology and the Treatment of Mental Disorders. If you get a chance, there's a little funny skit called The Phobia Party. I find it quite amusing. You might too, so check it out if you get a chance. So, as we transition from cognitive therapy, behavioral therapy, desensitization, psychoanalysis, humanistic therapy. Now we're going to move into the actual part that gets medical doctors involved. Psychopharmacology, using drugs to treat mental illness. Psychopharmacology studies the effects of drugs on mind and behavior, and it by far is the biggest growing part of the treatment of mental disorders. So we start with the antipsychotic drugs. So the antipsych drugs are used to treat some severe mental disorders such as schizophrenia and other DSM-5 disorders. So antipsychotics, including risperidol, clozapine, Zyprex, they dampen the nervous system's response to stimuli. All right, especially in positive symptom schizophrenic patients. It helps take away those hallucinations. Many people who take antipsychotics feels it dulls their personality for obvious reasons. Another side effect, and there's a lot of commercials on TV about a drug to treat this now, which is kind of ironic, is tardive dyskinesia. This is a neurotoxic effect on the body from taking antipsychotics for a long time, including twitching and other abnormalities associated with taking antipsychotics. But now the pharmaceutical industry has taken advantage of their ability to make drugs to treat tardive dyskinesia. All right, so more antipsychotics, including Thorazine and Clozaril. Thorazine can treat positive symptom patients, especially schizophrenia, and Clozaril is used to treat negative and positive symptom patients. All right, schizophrenia is directly related to dopamine levels. Remember that. Excess dopamine, positive symptoms, movement, learning, attention, emotion, all those things. So these antipsychotics work with dopamine levels to change the response to stimuli. Okay. Now, by far, one of the most popular types of drugs is anti-anxiety drugs. Anti-anxiety drugs are used to treat anxiety disorders, obviously. They depress and slow down the central nervous system, and they help calm the person who's dealing with a frightening, anxiety-causing situation. Some common anti-anxiety medicines are Ativan and Xanax. But literally, there are hundreds and hundreds of antipsychotics and anti-anxiety meds out there today. Now, antidepressant drugs, remember, norepinephrine controls arousal and alertness. Too little, you can have a depressed mood. All right. Serotonin affects mood, hunger, sleep, and arousal. Too little, you can have a depressed mood. So antidepressants work on these neurotransmitters, neuropeptides, to help counteract how the body is producing or reuptake of these neurotransmitters. So antidepressants again leads to the most popular category of drugs for treating depression and sometimes bipolar disorder, and these are called SSRIs. Please remember this. SSRIs, that stands for selective serotonin reuptake inhibitor. They stop the reuptake from ascending neuron and allow more of the serotonin to transverse that synaptic gap, get to the new neuron, and allow more serotonin to flow freely. This counteracts the depression. These SSRIs include Prozac, Zoloft, Paxil, many others. Okay? So again, they increase availability of norepinephrine and serotonin. SSRIs. All right, some other therapies. ECT, electroconvulsive therapy, basically electric stimulation of the brain for severely depressed patients. Sometimes medicine doesn't work. They combine it with this, and believe it or not, even though it seems kind of brutal, people swear by it. They're anesthetized and they stimulate with a current through the brain. And again, this is a little documentary on ECT therapy. Okay, psychosurgery. More rare, more extreme. This is actually surgically going in and creating lesions or destroying brain tissue in an effort to change behavior. Lobotomies were common in the 40s, 50s, and 60s. That is psychosurgery. They actually went in and surgically detached parts of the prefrontal cortex with the thalamus and other parts of the brain to diminish unwanted emotional and violence in some patients. Very, very rare, very brutal, much less common today than it was decades ago. Now, there are some brain surgeries that work. And the little documentary on Newsy, this is not a lobotomy. This actually treats OCD. And it's a new category of surgery that has been deemed pretty successful for it. Now, last slide. New controversial treatments. We are on the precipice of some amazing new treatments for psychological disorders. They're controversial because in some senses they're illegal. The new controversial treatments are using hallucinogens and some other illegal drugs to treat depression, OCD, PTSD, and other anxiety disorders. And the studies have been remarkable on these new treatments and treating mental disorders. So, good video on this. Much more information coming out. Controversial because the government may say it's illegal, some of them. Some of them are actually accepted and under experiment right now. But there is a lot coming in the field of treatment of mental disorders when it comes to hallucinogens and psychedelics in treating mental health. That's it. 8B is a wrap. You guys have a great day. Talk to you soon with our final new module, which is Unit 9, Social Psychology. Peace.